EndyMed has two TC treatment handpieces that cover large areas, the large handpiece and the shaper handpiece. They are both specially designed for the treatment of skin laxity, body shaping and contouring, circumference and cellulite reduction in larger body areas. The shaper handpiece, with its circular electrode design, has a larger treatment surface that allows for the efficient treatment of larger areas, providing faster treatments. For body contouring and body tightening treatments, measure the patient's body circumference in the relevant area. In order for the measurements to be reproducible, please refer to the guidelines in the EndyMed application guide. While the patient is standing, divide the entire area to be treated into 10 by 10 centimeter areas when using the large handpiece, or 12 by 12 when using the shaper. When treating the abdomen, using a skin marker, create 2 to 3 squares at the lower abdomen and 1 to 2 squares at the upper abdomen. The number of squares depends on the total size of the treated area. If skin laxity in the umbilical area is prominent, add an additional square around the umbilicus. In order to emphasize circumference reduction, you may mark additional treatment areas in the flanks. Position the patient on the back with the leg extended to make the abdomen fully accessible. To treat the flank, the patient should be positioned face down with the treatment area raised on the pillow. When the menu screen opens, select the appropriate treatment option. Then select the treatment area. The system will automatically set the default initial treatment parameters. You may increase or decrease power according to need. Apply an EndyMed-approved ultrasound gel only to the area being treated, creating a uniform layer 2 to 3 millimeters thick. Position the handpiece on the first treatment area and begin moving it in a constant circular motion. Press the trigger on the handpiece. An audible signal and illuminating LED on the handpiece throughout the 30 seconds of treatment indicates the RF energy is being emitted. We recommend using the 3-line method for uniform heating and energy distribution. For further explanation, please refer to the application guide. Perform the preheating protocol as described in the TC treatment protocol video. For the large or shaper treatment, perform 2 passes and the temperature should be between 40 to 42 degrees Celsius. After reaching the desired temperature range, reset the passes counter to begin the actual treatment. Perform 10 to 12 therapeutic passes. Use enough gel for smooth movement of the treatment handpiece on the skin. Continue with other treatment areas in the same manner. Please note that the treatment should be relaxing and comfortable. In any case of discomfort or pain, stop the treatment. If the patient complains of a burning sensation, or if there is excessive erythema or edema, stop the treatment and move to the next area. To treat the thigh area, mark the treatment areas. Use 10 by 10 centimeter areas when using the large handpiece, or 12 by 12 centimeters when using the shaper. To treat the outer thigh area, position the patient lying on the side or lying face down with the leg to be treated bent forward towards the chest. For additional comfort, you may support the leg on a pillow. To treat the inner thigh area, position the patient on the back with the leg to be treated folded outwards. Position the handpiece on the first treatment area. Press the trigger on the handpiece and continue treatment in the same way as the abdomen treatment. You may use the 3-line method. When treating cellulite, it is recommended to perform 12 therapeutic passes. With EndyMed's 3 deep body contouring treatments, your patient will see increasingly visible results as the effects of collagen remodeling continues to improve for up to 3 to 4 months following treatment. In this treatment area, divide the arm into 3 rectangles: frontal, outer, and inner arm. We recommend using overlapping adjacent rectangles. The recommended application for this treatment area is the large handpiece. However, if the arm is too small, use the small handpiece. Treat the frontal arm with the patient lying on the treatment bed and the arm is straightened along the body in a comfortable position. Treat the outer section with the arm placed on the chest. Use a pillow if needed. The inner arm is treated with the arm bent upwards and toward the head. For optimal treatment contact, hold the handpiece so that the electrodes are parallel to the length of the arm and not perpendicular. Because skin thickness varies in different zones of the arm, you may have to adjust the power level in order to maintain the appropriate temperature levels. Continue treating the arm until you've completely covered the desired area. When done, please follow the treatment protocol. Following the treatment guidelines in the tutorial will ensure optimal results and customer satisfaction.